Hi everyone and welcome to the Microbiology section of First Aid Express. My name is Sean Alemi. I'm a resident at UCSF in the Department of Otolaryngology, Head and Neck Surgery. I'll be guiding you through the next 4 sections of micro. We'll start off with some general information about the classification of bacteria first, before going into specific information about individual bacteria, fungi, and parasites. Over the next few lectures, I'm going to present information mainly from microbiology, but I'm also going to take every opportunity to create integrations. I'll pull in pathology, neuro, pharm, physio, and as much as I can to help you create unforgettable connections. Along the way, I'm also going to ask you a lot of questions. Some of them will be rapid fire. Others will allow you more time to think. Don't be discouraged if you don't know the answer. The point of these questions is to help you learn by exposing what you don't know. I'd rather that you miss it here with me and get it right on the test. Okay, enough with the formalities. Let's get started. First up, basic bacteriology. Buckle up. Bacteria are single-celled prokaryote organisms with several structural elements that distinguish them from eukaryotes. We will talk about the most important bacterial structure on the next slide, but before we get there, I want to touch on a few of the other key features. Like eukaryotic cells, bacterial cells are surrounded by a phospholipid bilayer. You may remember the appearance here. There's your phospholipids, and remember, it's a bilayer. And you're going to have an entire membrane basically composed of that. Quick biochem integration here. Do bacteria have mitochondria? I'm hoping you're saying no. This is one of the key differences actually. And what important activity takes place in mitochondria? Well, that would be the electron transport chain. But wait a minute, if bacteria don't have mitochondria, then where does that action take place? Bring it home, folks, the plasma membrane. The plasma membrane is the site of the electron transport chain. Okay, so building on our cell here, let's quickly draw some ribosomes. Yep, site of protein synthesis. And how do bacterial cells get around? What is the source of their motility? That would be the flagellum. The flagellum is a protein structure that basically whips around like a little tail to allow the cells to move. And remember that bacteria have a circular piece of DNA, not a double-stranded helix, like in humans. So there's our DNA circle. Okay, now that we've covered some of the basics of cell structure, we should really focus our discussions on the cell wall. This is something that you're likely to see on your exam. In fact, the composition of the cell wall is what creates the distinction between gram-positive and gram-negative bacteria. So, within the cell wall, there are a few key players we must identify. First, you have the capsule. We're going to draw the capsule surrounding this. Now, the capsule is a sugary structure which basically protects the cell against phagocytosis by neutrophils. Underneath the capsule, you have the peptidoglycan layer, right there, in red. Again, a sugary structure that gives rigidity and protection. So what makes a bacteria gram-positive or gram-negative? Well, if you remember from micro lab, when you do your gram stain and wash, some of the bacteria retain the gram stain better, and these ones are called gram-positive. But why? Well, the thick peptidoglycan layer actually traps the stain in and doesn't allow it to wash out. So, gram-positive bacteria have a thick peptidoglycan layer. Let's say that's our peptidoglycan layer in the gram-positive, whereas gram-negative bacteria have a very thin, wimpy peptidoglycan layer. Here's another diagram of a bacterial cell wall. There are several key components to this cell wall. What do we call this space right here? That's called the periplasmic space. Good. And what is it an important source of? Well, the periplasmic space contains enzymes necessary for bacterial virulence, such as proteases, phosphatases, lipases, and beta-lactamases. Excellent. And just to recap, here's the inner cytoplasmic membrane, the peptidoglycan layer right there, and the outer cytoplasmic membrane. Okay, so we've talked a little bit about cell wall structures. Now, only gram-negatives contain LPS, or lipopolysaccharide endotoxins, within their outer membrane. Whatever, right? Wrong. LPS and endotoxin are a big deal. A little infectious disease integration here. The release of LPS is what causes septic shock. Hang on just a sec. What is septic shock? Do you remember the signs and symptoms? I'm thinking of fever, hypotension, tachycardia, and altered mental status. Endotoxins activate host immune cells and cause macrophages to release TNF-alpha, interleukin 1, and nitric oxide, which all cause massive vasodilation and severe hypotension. Shock is a really big topic, and we don't have time to cover it all here, but here is one more thing I want you to take away. In hypovolemic shock, which can happen after a major volume-depleted state, such as trauma or severe dehydration, what happens to peripheral vascular resistance, PVR? PVR will be high because the body has a massive adrenergic response. So, how will your patient look and feel? You may have heard the words cool and clammy. They will have cool and clammy skin. Cool and clammy, cool and clammy. If you see this on your test, you better think of hypovolemic shock, and you better start replacing volume. On the other hand, in septic shock, because the body has a massive vasodilatory response, the patients will actually feel warm and have flushed skin. Remember this key difference. Time for our first flash quiz. What component of the gram-negative bacteria contributes to the development of sepsis? Answer is lipopolysaccharide. There's a really complete table in your book about bacterial taxonomy, but don't worry too much about trying to memorize it right now. The more you use this language, the more familiar you'll become. The best way to use it is as a reference. Just flip back to it as you learn more bugs, and make sure you're remembering which ones are gram-positive, which ones are gram-negative, and so on. But while we're here, can you tell me which one of these three is gram-negative? Remember, gram-negative organisms show up pink on staining, so this one is your gram-negative rod. This is actually a stain of Pseudomonas, which we'll talk about later. Great. And of the two remaining images, can you tell me which one is staph and which one is strep? Well, staph is always in clusters, and strep is always in chains. Excellent. We've already touched on the subject of cell walls, but there are two bacterial organisms that bear special mentioning here. Mycoplasma completely lack a cell wall. Mycobacterium, on the other hand, which is pictured here, has a cell wall, but it contains mycolic acid, which is a fatty acid, in addition to the polysaccharides, peptidoglycans, and lipids. These unique properties pose challenges to gram staining and identifying Mycoplasma and Mycobacterium, so we can't use the conventional gram stain. For Mycobacteria, we are forced to use acid-fast stain, and we are generally not able to stain Mycoplasma. In addition to Mycoplasma and Mycobacteria, there are several other bacteria that do not gram stain well. Remember, gram staining is an important staining technique that allows for differentiating bacterial strains based on the physical and chemical properties of their cell walls. Gram-positive organisms appear blue or purple, whereas gram-negative organisms stain pink due to the counterstain. The organisms listed here are those that cannot be identified via gram stain, but can be differentiated using other techniques. We've already mentioned Mycobacteria and Mycoplasma. Mycobacteria have lipids in their walls, while Mycoplasma cannot be stained at all because it simply lacks a cell wall. As I've mentioned, Mycobacterium cannot be gram stained, but it can be stained with the acid-fast method, which takes advantage of the high lipid cell wall content. Mycobacterium will be bright red after staining. These are often called AFBs for acid-fast bacilli. Treponema is too thin to be visualized, so one must use dark field microscopy or fluorescent antibody staining to see it. Legionella, Rickettsia, and Chlamydia are intracellular parasites and difficult to see. Therefore, you must use immunofluorescent staining to visualize these organisms. Legionella can also be visualized by a silver stain. To help you remember these organisms, I like the mnemonic, these microbes may lack real color. A few words on the important stains that you're most likely to see on your test. PAS, or the periodic acid shift stain, is really good at staining sugars like glycogen and mucopolysaccharides in the cell wall. When you hear this stain, what bug should immediately come to your mind? The bug I'm thinking of is T. whipple. That's exactly right. So here is a PAS stain of a biopsy of small bowel. Here are your cells, and then you have these bright red areas of PAS positive stain, which is where the bacteria are. Wait just a sec. You didn't think I'd miss the GI pathology correlation, did you? What disease is caused by T. whipple? If you know it, shout it. The answer is Whipple's disease. And what are some key symptoms of this disease? Well, arthritis, diarrhea, and abdominal pain. The Zeal-Nielsen stain is used to detect acid-fast organisms. Zeal-Nielsen is synonymous with acid-fast. And remember, this stain is particularly good at staining the mycolic fatty acids in the cell walls of mycobacteria. India ink can be used to outline the capsule of Cryptococcus neoformans, which you can see really well here. Here are the big, thick capsules of the cells. Lastly, silver stain is used to visualize fungi and Legionella. The bugs stain black on silver stain, as you can see them here. This particular one looks like a fungal stain, as you can see with the branching hyphae. Okay, time for another flash quiz. Your patient has PAS-positive macrophages on a small intestinal biopsy. What diagnosis should you consider? I'll give you a few seconds to think about this. And the answer is Whipple disease. Remember that Whipple disease, the organism T. whipple, is going to form PAS-positive globules on small bowel biopsy. The type of media that is used to grow the organism can actually tell you a lot about that particular bug. In fact, the media can be used to differentiate organisms. Media can be selective, meaning it contains antibiotics to prevent growth of contaminating microorganisms, such as Thayer-Martin media, which contains vancomycin, polymyxin, and nystatin to inhibit growth of organisms other than Neisseria gonorrhea. So you might plate a bunch of different bugs onto a petri dish containing these compounds. You incubate this at 37 degrees, you come back the next morning, and you will only see one type of colony that has survived. Media can also be differentiating, meaning it induces only the bacteria you are interested in to change color so you can distinguish them from everything else. An example of this is McConkey's agar, on which lactose-fermenting bugs such as E. coli will grow as pink colonies. On the other hand, lactose non-fermenters such as Salmonella and Shigella will grow as colorless colonies.